It is absolutely good to be here because there was, I guess, a possibility that I wouldn't have seen July of 2020. On March 25th, I woke up with a 99.5 fever. If I had not known what we knew about COVID, usually starts with a low fever, I would have simply taken some Tylenol and gone to work. Now, for me, the last 5 days, after the 7 days of low-grade fever, the last 5 days got to be very scary. I was very sick. By June 1, I will tell you that more than 700 of our employees, more than 20% of our workforce, had contracted COVID. 4 of our employees died in the 6-week period after March 15th. And dozens of our employees were hospitalized. But with all of this going on around us, our staff was focused on the mission, focused on safety, and focused on each other. But nothing drove employee engagement at all levels like COVID. Managers connected with their employees in ways we had been begging them to do for years. The number of manager recognitions on our recognition platform doubled. Every day, stories of heroism, creativity, and resourcefulness were told at our organizational hubs. The number of peer-to-peer recognitions jumped up as well. We instituted a feed from the social platform on WorkProud that was displayed in the cafeteria so that employees could see other employees being recognized. It went viral. Our leaders need to make sure that that feeling that our healthcare staff has, that attachment to mission, that teamwork and social re-engagement in the workplace, and that journey towards safety becomes something we can actually capitalize on. Everything is in front of us. Whatever healthcare looks like, it hinges on the engagement of our employees.
At some point when you get serious about this, you create a platform where it can more easily be done that has tools that people can use, leaders can use, employees can use, peer-to-peer based, organizational tracking. And the gold standard to make this happen is to move it to a software platform. And with that, you can also have an app to make it easy to use. And everyone has their phones today, so this makes it universal.
You know, for years, as I rounded around the hospital, one of the things that we all did as senior leaders is try to get people off of their phones, right? You'd go and you'd see a nurse on her phone. Why are you on your phone? You should be taking care of patients. Our employees are not engaged because they're on their phones all day long. We all hear that.
Right.
But you know what? We have been unsuccessful in getting people off of their phones, and we're unsuccessful in getting ourselves off of our phones. So where that device is an acceptable tool, let's make it something that is engaging for work. So maybe when we see them on their cell phones, instead of shopping on Amazon, they're actually looking at recognition and giving recognition. So we can't change their attachment, and the psychologists don't like when I say this, addiction to these devices, but we can make sure that you're using it for a good purpose.
I'm hearing from frontline employees that say, my VP liked the recognition I got. They know who I am. They know what I did. Life is good. This is right. It brings it all front and center. That's the power of this.
So, you know, people ask us a lot about, you know, the technology and the format of the program, and we're sort of sharing with clients, look, the form of the recognition experience is fundamental in that we have been trained by the tech titans with trillions of dollars behind them, of the Googles and the Facebooks and the Amazons and the Instagrams and the TikToks, and their experiences and their knowledge, skill, and capabilities associated with building connectivity between a device, right, and whatever that emotional experience is that you have when you're on Facebook or TikTok or the other one, is core to what people are expecting, because they've been trained at a consumer level of this is the level of experience you should have.